Okay.
All right. Good morning, everyone. You're welcome to today's edition of Tecla, Tele-Education for Clinicians and Leaders in Africa. And we are pleased to have you this morning. Today's session will be focusing on euthanasia in animal, and it's going to be a very, very important discussion for every one of us here on this call this morning. To our partners for Tecla, we have MDoc, Making More Health, Oringa Ingalhem, Ashoka, the Veterinary Council of Nigeria, and Project ECHO. So for our meeting this morning, this is the agenda for our meeting. We're going to have introductions, and then Dr. Zainab is going to give us a brief about Farmalat, after which we're going to have a pre-quiz just before our hub experts, and then our hub experts would have 20 minutes each to share with us what they have for us. After that, we'll now have an open discussion for all participants, which also includes questions and answers. And then expert recommendation on the topic by our hub experts. We have the post quiz, and then we call it a day. So briefly, the topic is something that hasn't always been discussed in the veterinary space. It's a topic that most clinicians shy away from, even pet owners or clients. But today we are going to dive deeper into the topic and then hopefully learn something substantial. Now, moving on, we are going to using video conference technology to leverage scarce healthcare. Also, another overview, another pillar of ECHO is we use resources and then specialists will share best practices with colleagues. And then it is case-based learning and then continuous monitoring of program outcomes. So briefly, just take note that this session is recorded and we are going to be making the PDF versions of the slides available to participants after the session. So for participants, just kindly take note that we would love to have your cameras on. We would ask you to unmute when there's a need for you to speak. You can always use the raise hand feature anytime you want to speak, especially during the question and answer session where you would want to ask a question or make a recommendation. And kindly use the chat function for any question. If while the hub experts are on and you want to ask a question, you would advise that you use the chat box session. So quickly, I'm going to be inviting Dr. Abdullahi Zainab to quickly give us a brief overview of Farmalat.
All right. Hi, everyone. As introduced, my name is Dr. Zainab Abdullahi Biu, and I serve as the Community Engagement Manager here at Farmalat. Farmalat is an animal health social enterprise founded in the year 2019 with the primary mission of enabling easy access to affordable animal health care in undeserved communities in Africa. Animal disease are the leading cause of losses to livestock farmers and pet owners, accounting for over 70% of the total damage. Unfortunately, the animal health system in Africa leaves little to be desired and goes a long way to adversely affect the farmers, pet owners, who are the lifeline of our local food system. At Farmalat, we have been able to combine our relevance as a major animal healthcare brand in the marketplace with our mission of ensuring easy availability, accessibility, and affordability of this animal health product and services across the country. We partner with local animal health professionals, mainly veterinarians, who partner with us local farmers, pet owners in building an inclusive system for sustainable animal health and disease prevention. We also foster a peer-to-peer network where access to regular animal health products, veterinary services, and pieces of training can be easily obtained, and learning at various levels of farmers' interaction shared. Summarily, we are enabling easy access to quality animal health across Nigeria and soon across Africa. Our Tecla section are in partnership between the largest privately held animal health company in the world, Boehringer Ingelheim and Ashoka, an organization designed to support social entrepreneurs using the Making More Health platform with the help of the MDoc, our executive partner. Our Tecla session moves knowledge rather than people by utilizing digital technology like the video conferencing we are currently using. It is our utmost desire that you find this session both useful and inspiring in your various chosen areas of specialty. Once again, I warmly welcome you to our ever-growing animal health community where we drive absolute pleasure in helping you win. Please enjoy this session. Thank you.
All right, thank you so much, Dr. Zainab. So quickly go over to the pre-quiz. So the quiz is on now. So can you just go over the quiz and answer? Okay. I believe you're answering the questions. There are 5 questions for us here to engage us before our hub experts would come up for their presentations. And these questions are meant for us to answer. So kindly, if you're on the call, kindly participate in the pre-quiz. We have just 3 minutes more before we end the pre-quiz. So if you're here, just quickly go over and then answer the question. Okay, just a few of us on the call are participating in the quiz currently. It's meant for everyone on the call. Okay, that's nice. Okay, we are seeing improvements in the responses from the pre-quiz. Just about a minute more before the end of the pre-quiz. You are just joining, we are currently having our pre-quiz before our hub experts come up for their presentation. So can you just quickly engage the pre-quiz and test your knowledge about the topic of discussion this morning? Thirty seconds more before the end of the pre-quiz. All right, thank you. Thank you for those that have participated. Okay, so we'll quickly move over to our first hub expert for this morning, Professor Khalid Talha Bayobako. I'll quickly read out his citation. Professor Tala Kali Bayobako is a professor at the Department of Veterinary Pharmacology and Toxicology, Faculty of Veterinary Medicine, University of Ilorin, and a fellow, College of Veterinary Surgeons of Nigeria. His experience in veterinary teaching, research and extension services, and administration spans approximately 20 years. He served as head of department and head to clinical units of the Veterinary Teaching Hospital, University of Ilorin, editor-in-chief of the faculty journal, Veterinary Teaching Hospital Clinic Coordinator and Deputy Director, Departmental Postgraduate Coordinator, Examination Commissioner, and External Examiner to various veterinary schools within the country and internationally. His research interest lies in stress pharmacology, ethnopharmacology, chemotherapy, animal transportation, therapeutic welfare and meat, and cytokines research. He has over 70 publications in reputable journals, edited conference proceedings, and chapters in books. He has successfully supervised 3 master dissertations, PhD, and numerous fellows of Postgraduate College of Veterinary Surgeons, Nigeria. He is presently the co-founder and CEO of Pyramid Veterinary Clinic, Ilorin. He has national and institutional research grants to his credit and was honored Best Lecturer for 4 consecutive times. Prof. Bayobaku is a member of numerous professional bodies. You are welcome, Prof.
Thank you very
Thank you
much.
so much for joining in, and you have the floor now, sir.
Thank you very much. I'm going to speak on advancing euthanasia in modern veterinary practice. And from the word euthanasia, it takes its origin. These are the outline of my presentation, just to show some pertinent slides and subtitles. The origin of the word euthanasia takes its basis from 2 Greek words, mainly eu, then thanatos. And this simply means, in other words, the act of inducing death in a humane way. And therefore, there is something pertinent about euthanasia that every veterinarian should bear in his mind. And these are as follows. When inducing euthanasia, the process should be smooth, it should be transient, non-agonal, and apparently painless. And most importantly, it will lead to a permanent state of calmness and sleep. That is euthanasia in my own perspective. Next slide, please. Then, when we talk about advancing euthanasia, we cannot but give credit to some people that had worked previously and till date are worthy of being credited to such. At the ancient time, we cannot forget a name like Aristotle that worked as the foundation in introducing the concept of euthanasia in his book. Then coming close to our time, we cannot forget names like Avicenna, as his name, a Persian physician and philosopher that wrote extensively, but not specifically on euthanasia, but mentioned ethics in medicine. Razes, as he's called, a Persian pharmacologist, discussed the concept of euthanasia in the context of ending suffering in animals. Other names: John Stuart Mill, Tom Regan, Bernard Rolling, and Peter Singer, all from different geographical regions in the world, worked hard and are still working. Deborah Jones, all these are contributors to the field of animal euthanasia, and credit should be given to them. Globally, the ethical trends for consent, to seek consent, is either by direct or verbal way, either by giving a form or ensuring that you give a written statement. Also, now the world is already going through a kind of digital and IT millennium. So consent can be sought through sending of mails. For example, if the owner should send his pet through maybe someone and the owner is somewhere else, you can send a mail, or through this medium that we are using, or by direct communication through a mobile. You as a veterinarian, the animal was sent to you that you should euthanize through maybe an attendant, and you want to be sure, so you have to ensure you still call the owner and even records the communication, because some people, after consenting, might withdraw the consent. So you have to record so that it will not lead to litigation. Then in some instances, even after giving a form, a very important component should be a component of witness. Then appropriate counseling should be given to enlighten the client or clientele pertaining to euthanasia. Then even after the process, you have to ensure you give psychological and moral support, because this could be done through different digital media, different IT, or different ways of communication to pacify, because it's a great loss. Maybe a pet had spent time with the owner and you are the one that will euthanize with the consent, of course, of the owner. Then the appropriate method that you will adopt should be in conformity with the philosophies of that community. It should not be contrary to the philosophies. Then what are the reasons for euthanasia? Basically, to relieve the suffering of the animal. If the animal had suffered an incurable disease or in infectious chronic zoonotic diseases, and sometimes this could be sometimes in this second point, it could be euthanasia, but it could be slightly cruel, because the person that is eliciting it must be far away and must also protect himself or herself, or the party involved will protect himself or herself, as the case may be. Then in third stage cancer, when you know that prognosis is quite very poor, then also to relieve the moribund animal in the case of a debilitating disease. The animal is already very debilitated, catatonic, and will not recover. Then also sometimes when the cost of treatment of the animal is more than the value. Scott, in his book, especially in cesarean sections, and you know the cesarean section supersedes or is more expensive than the animal, sometimes they resort to shooting the animal. But this case is not very, very common here in Nigeria, because the cost of veterinary services is quite cheap. Then also to relieve the animal from suffering after a particular experiment. But after a particular experiment, the method that will be adopted will be as written in the consent form of the person that is presenting that research as an ethical research. So the method that was granted to him, and the most standard method that is given in that consent form, and the most ethical method that the ethical body of a university or the granting body, as the case may be, is given to that researcher must be carried out. Then other reasons is bringing peace, for example, to the owner when he sees his companion or the pet suffering, then to minimize agony or struggling of the animal due to pain and obvious apparent suffering or pain. Then to ensure a smooth, easy, and transient and permanent sleep of tranquility. Then also to adhere to the veterinary oath, as the case may be, which is relieving animal suffering. What are the requirements? The requirements of anesthesia, first of all, ethical permission. Whether you are the person that will induce the euthanasia or you are a researcher terminating your experiments, there must be an ethical undertone to reaffirm that this animal is not just taken like that, but with value and with a particular respect. Then the method that will be carried to elicit this euthanasia should be in line with the laws of the land. It should be carried out by an expert, someone that knows the landmarks, someone that is a professional, someone that had done it again and again, and that is not just trying or experimenting, someone that has the expertise. Then it should be also conducted in a non-public area, because some people's hearts for animals, it could cause a psychological trauma when you are carrying it out, and also from an animal-free area, because if you do it in an area where animals are very many, or where other animals see the process and they see other animals dying, they could hibernate completely. This is very common with cats. They could completely move their population from there. Then also, it must not cause any kind of apprehension, anxiety, pain, and most importantly, it should cause a complete shutdown of the nervous system centrally and bring about respiratory and cardiac arrest. But all these are independent, dependent upon one another. First of all, central will affect medullary paralysis, and eventually this will cause a shutdown in the cardiac and respiratory function. And this should occur smoothly and would occur in line. So this would occur smoothly and transiently and respectfully and in a non-abundant way. Then the method adopted should put in when you want to do such, when you're going to carry out this kind of process, for example, you have to put into cognizance what species are you dealing with, because you are dealing with amphibians or reptiles, or you are dealing with neonates, or you are dealing with fish. You have to put in mind the appropriate method. Otherwise, if you use the inappropriate method or you use a wrong method, the animal will just continue to suffer, because some of these species, if you say you want to suffocate this, they have other physiological adaptation that they can be alive for some time and you just be suffering there. So you have to ensure that you do the right and you conduct the right method and put in place the right equipment. Then other requirements you should also put in place is that the gadgets or the equipment that will be used should not be injurious to the operator, or should not be injurious to the maybe to the anesthesiologist. So the anesthesiologist will be eliciting or inducing euthanasia and will be inhaling something. And this is in cases where chambers or machines are used. Then also all machines, chambers, and jars must be safe and intact. And also the drug to be used must be easily available and cheap. Then we get also to the next, what are the next slide after the drug. The requirement is how are we going to next slide, please. What are the requirements? The requirements pertaining this. And at my last slide, I mentioned a drug, and you cannot conduct euthanasia without using an agent. And that was why my last slide here is a drug. So, and I continue from the drug. Then the drug, which is an agent that you are sending in there, must be a drug that does not have the tendency for abuse or misuse by the person involved or by the person that is going to conduct it. And it should be cost effective, and it's better if you are going to use a drug that you use a syringe, which is a cheap means of sending the drug in there. A device that was invented by Alexander, who very cheap. It's better for you to use that than to use a chamber, you understand, which is more expensive and needs more expertise. Then also, that drug you use or that agent of euthanasia that you intend to use should be eco-friendly, such that you don't use a substance that will cause an imbalance in the ecosystem, causing death in animals and causing an imbalance in the ecosystem. And also, it should also be a drug that will not mutilate the animal, not something like acid or something like something that will mutilate the body of the animal. But it should be a drug that will be used that will ensure a high that will keep the animal to sleep transiently with great respect and honorably, but in law with a great caution to ensure a great respect and pity for the animal. What are the factors to be considered for selection of the drug that, and these the factors must definitely go in concordance with the ethical reasons. One, the drug must be from a reputable source. The drug must be from a reputable source, from a good company, and not that it is not a drug that is not approved or it is still undergoing preclinical or clinical trial. The drug must be globally acceptable for use in euthanasia, not a drug that is not globally acceptable. Then the mechanism of action of such drug must be to achieve the purpose of euthanasia, that is, to make the animal unconscious, to achieve the triad, which is to reduce pain and decrease or irreversible unconsciousness, and the third is to cause a final permanent sleep and cardiac arrest, or as the case may be. Then also, the appropriate route of such drug must be used in delivering the drug to the sites to ensure humane death. Next slide. Then what are the classes of these drugs that can be used? We have the inhalant gases, as seen. We have the inhalant as anesthetics, which are very common. These agents are used also in inducing anesthesia, but at a very high. These gaseous agents or inhalant agents, you have to give in a dose that is above the normal dose, because these agents should be given in a very high dose to cause euthanasia. Next slide, please. Then we also have the injectable, which is the barbiturate. Barbiturate, tiopental, pentobarbital, amongst others. Then we have the miscellaneous. The miscellaneous are different classes of drugs: chloral hydrate, tricaine, mesylate, magnesium sulfate, potassium chloride. All these are drugs that are miscellaneous that could be used also. Next slide. Then we, from the pharmacological perspective, as veterinarians, we should bear in mind that there are some drugs that interact with euthanasia agents, so that we prepare our minds for either influencing these agents or causing hindrance to these agents, as the case may be. And this varies from one species to the other. For example, the anticholinergic agents interfere. Alpha-2 adrenergic agents, or alpha-2 adrenergic agonists also interfere. Benzodiazepines interfere. The opioids interfere. The neuromuscular blockers also interfere. Others also are the anticonvulsants interfere. The antidepressants interfere. And also, most important, we have some chemotherapeutic agents that could induce or could inhibit these agents. For example, chloramphenicol will influence the effect of euthanasia agents through interaction at the pharmacokinetic level of metabolism. Then also, we have erythromycin. It can also interfere. Then the non-steroidal anti-inflammatory, phenylbutazone, could interfere at the distribution phase, as the case may be. Next slide. Then also the anesthetic interfere also. They are euthanasia agents, and they also interfere with also the euthanasia itself. Next slide, please. Then the chemical method of euthanasia, what is needed to be achieved? When you give this agent, what do you want to achieve by this agent? You want to achieve unconsciousness, respiratory, and cardiac arrest. You want to also achieve medullary paralysis, because the medulla, from our basic physiology, controls the heart, controls some very important organ. So when you cause paralysis, there will not be a control, central control in this, and the animal will definitely go into delirium and will also cause irreversible desensitization of the nerves. Note, when you use an anesthetic agent within the therapeutic dose, it causes irreversible. When you use above the dose, above the therapeutic dose, it causes irreversible desensitization. Then also it causes irreversible impulses and sensory activity. There will be irreversible loss of impulses. Then also transient, I will repeat, smooth death without struggling to a permanent tranquil sleep. Then also, what are the moods? Basically, there are three things to be achieved. One, most cause hypoxia or central depression acting on the reticular activating system, and this eventually causes polysynaptic interference and impulses going to the precentral and postcentral gyra, as the case may be. Then it also causes physical damage to the brain. Most methods that cause physical damage are physical methods. Then, what are the considerations for inhalant gases? These include what the right concentration. You must, if you want to induce euthanasia, if you want to induce euthanasia, you must give the right dose, which is double or triple the dose of the normal anesthetic agent, whether it is the gaseous or the injectable form. Then you must use the right equipment, the inhalant, using a chamber, especially if it is in amphibians or neonates, and you should put in mind that in the case of neonates, because of they still require lower, what should I say, lower oxygen pressure, they stay longer, because no matter, they stay longer. This is for experimental animals that are neonates. Maybe you are conducting a reproductive experiments in maybe some filial generations and want to do the right way to euthanize the neonates. After the experiment, you must appropriately ensure that you use the appropriate equipment and appropriate method, and put in mind that they are resistant. Then also you have to ensure that when you are also using the chamber to induce euthanasia and there is a noise, this will cause anxiety to the animals, and eventually this will also prolong their stay, because anxiety means more, the animal will be more agitated and the animals might stay longer. So you have to be very careful to ensure that the animals are not apprehensive. So it should be in a tranquil, smooth, and silent way. Also, the animals to be euthanized. If you conduct an experiment together and you know that you kept animals in different groups, and in a group of 5 or group of 6, then it means that when you are euthanizing them, you have to euthanize them in a group. And also when you are euthanizing, then you don't euthanize those that are maybe more aggressive in the hierarchy, social hierarchy. You go and put the ones that will bully others, so that they will now trample on the young, to the poor, the weaker ones, and this will also cause apprehension to the ones at the lower hierarchy, social hierarchy. So eventually this will cause apprehension to the ones at the lower hierarchy, and it will cause psychological problem to the animals. So also we should also consider that using the right method in reptiles, amphibians, and birds, because we should remember the physiology of amphibians and birds, that these have their peculiarity and they will relatively stay longer when you are using inhalant anesthesia. Then also, inhalant gases are not recommended in animals that are less than 4 months, especially in reptiles, amphibians, and birds, because their lung is not completely, they can still withstand. So this will let them stay longer. Then what are the agents? First of all, we have carbon dioxide, and at 10%, it will cause the following: tachypnea, muscle tremor, sweating, and others. At 20%, it will cause cyanosis. At 60%, this will eventually cause insensibility and followed by death. Then at 70%, it will cause it is the best because that is the best concentration that you use that will be compressed, and this will be the best to achieve what should I say, euthanasia. Then we have carbon monoxide. Carbon monoxide has a higher affinity than oxygen, and this will alter the sigmoid curve of hemoglobin and oxygen, which is physiological. So this will also alter the binding of histidine in the hemoglobin. So when you use carbon monoxide, because it has high affinity, almost 200 and 250 times. So this will now cause a complex which is more, that has higher for hemoglobin, which will form carboxyhemoglobin, and instead of the normal oxyhemoglobin, and this will now cause the death of the animal because there will be and the cells will not have oxygen, and this will affect the central nervous system and the general physiology, and death will now be caused. This method is used in between 4 to 6% in animals, as some authority have uttered. Then the gaseous inhalant anesthesia should be given at least, I told you, 2 times or more concentration. And also, when you are giving this, what do you want to achieve? You want to achieve what the animal taking in a higher concentration, and this will cause medullary paralysis. Then also halothane is a preferred euthanasia agent because it has a rapid onset and causes smooth death. Next slide. Then we have the inhalant anesthetics, sevoflurane, although these agents are in Nigeria, they are quite expensive, but they are the best in inducing anesthesia, apart from the barbiturate, which is sodium pentobarbital at 20%. So, but these are relatively expensive compared to other agents. For example, sevoflurane induces seizure and death, and some authorities believe that they don't want any form of apprehension or any form of. Then isoflurane is highly potent, but also causes unconsciousness. Enflurane is very expensive and is not advisable to use except in clientele that can afford it, of course. Then methoxyflurane is quite slow, and you don't want to use something that is too slow, especially in the amphibians and reptiles. Then injectable agents. In the injectable agents, we have to use the appropriate agents, and we have to ensure that it will cause rapid death. And also the routes, it should be parenteral and it should be predictable. The most predictable route is the intravenous route. Then also in moribund animals, because when the animals are in the late or critical, when the animal is already moribund and debilitated, you might not get the vein, this practically. So you can go for the intraperitoneal route when using the injectable anesthesia. Next slide. The barbiturates. These are barbiturates that could be used with sodium pentobarbital at 20%, is in combination with the local anesthesia. And the local anesthesia, you can use 2 or 3 agents together to ensure successful induction of anesthesia. You can use 3 agents. You can give a sedative, you can give a local anesthesia, and now give a sedative, and now go ahead and induce anesthesia using either an intravenous agent or using a gaseous agent. You can also use one of these agents by causing, what should I say, anesthesia, and then by ensuring you give a deep sedation, you induce anesthesia, then you now increase the dose to cause a transient death, and now you can go ahead and even use the physical method. So you can use 2 or 3 methods concurrently to ensure appropriate transient euthanasia being elicited. But the dosage at least should be 2 or more times higher. And we should also bear in mind that the animals we should have history, that if we should have history as clinicians, that in animals that are fast metabolizers, we should give even more than 3 or 4 times, because there are some animals that are fast metabolizers, and this will now, and the animals will metabolize within a very short time, and we seek to prolong the process. Then the miscellaneous agents are as follows: chlorohydrates, we have trichine mesylate used in fish. Also, we have magnesium sulfate, then we have potassium chloride, which causes cardiac arrest when administered with general anesthesia. Next slide. Then, I know food animals, a lot of us in Nigeria and in the practice, a lot of large animal people that are breeders of large animals might not want to go for euthanasia. Why? Because one, the cost, and the animal can be edible. But ethically, if you conduct experiments using food animals or small ruminants, as the case of food animals, the most ethical method that you use in food animals, which is not too common here in Nigeria, but it's internationally acceptable, is by use of overdose of anesthetics. And also you can use a gun, a shot. You can use captive. Both these are physical, non-pharmacological, non-chemical methods. And also you can also use common injectable anesthetics, but in a very, very high dose. Next slide. Then we have the physical methods, which is shooting, captive bullets, cervical dislocation, decapitation, electrocution, microwave radiation. Microwave is a source of radiation, and this will interfere with enzymatic and enzymes of metabolism, because that can eventually cause problems or distort physiologic homeostasis, and this will eventually cause anatomic changes, then stone, then pitting of the brain, then ensanguination also. This method is by bleeding, and it will deprive the animal of blood. Then the site of gunshot in the animal, as seen, is as follows. This is the site, the spot for the gunshot this is as authored by Scherer. Next slide. Next slide. Then after eliciting euthanasia, what next? The next is we have to appropriately dispose the carcass. And after death, and after ensuring the animal is dead, so you have, after ensuring the animal is dead, you have to ensure that proper carcass disposal. First of all, we have different methods. You have to dispose in waterproof bag, then seal in some, depending on the animals. If they are experimental rodents, mice, you have to dispose in B2, and then close. Then also, in some instances, instead of, you just don't go and throw in the bin, you have to put an appropriate burial bin in cold rooms. Then eventually also, if it is at the phase of completion of a research, you just don't have to trash, because you must have used the animals either in drug research or in one, and you must have injected some agents, and you don't want other animals to take these source of chemicals into the ecosystem and mess up the ecosystem. And also, if you have carried out some either genetically modified gene modified species, or you have worked on animals by modifying their genetic codes or genes, you have to ensure that transgenic animals are not just fed to any animals, because this will interfere with the DNA and could cause other form of very complex it might interfere with them and cause epigenetic changes, and these animals will eventually become wild or now change their form or change their genes, and now will cause genetic modification, as the case may be. Then also, you don't feed animals with if, for example, you want to feed animals animals that are euthanized, you use the appropriate method. You don't use the chemical method, because these agents are highly toxic, and we can recall in the history in Asia when non-steroidal anti-inflammatory was given to food animals. Some vultures fed on these animals, and it depopulated the Asian vulture population and scavengers. So we don't want to cause that. Then also, if you have given barbiturates in high dose, you don't use such in animals. You don't use such animals that you have euthanized with barbiturates for food for other animals. So, except if it is animals that you have conducted physical method of euthanasia, you can either use such animals either to feed animals in zoos when they are confirmed that they are healthy. Then also, disposal must be in accordance with the with the experiment that is conducted and what is granted in your ethical letter for the experiment. You'll be given an ethical permission. What is the method that is written there? If it is written there, you should use electrocution, it should be electrocution. If it's microwave, you have to use microwave. So you have to go in conformity with the international standards. And thank you very much for giving me this opportunity. These are some of the references that I have used. For those that want to read more or want, thank you very much.
All right, thank you so much. Thank you so much, Prof, for that presentation. Thank you for leading us into the pharmacological point of view of euthanasia. You know, one of the highlights for me has to be some of the drug interactions and also the availability of some of these drugs in this part of the country, as well as the costs of some of these drugs. You know, and again, the issue of seeking consent and then pre-counseling and post-counseling of the client during the course of the euthanasia process. Thank you so much, Prof. We would get to the question and answer session after our second hub expert takes the floor. So our second hub expert is Dr. Fatai Mobolaji Lawa. I'll quickly read out his citation before he comes up for his presentation. Dr. Fatai Mobolaji Lawa is a well-experienced lecturer in veterinary anesthesia for about 15 years, first at the Department of Veterinary Surgery and Radiology, Usman Danfodio University, Sokoto, and now at the Department of Veterinary Surgery and Radiology, University of Ilorin. He had his academic qualifications from University of Ibadan. Dr. Lawa is a fellow of the Postgraduate College of Veterinary Surgeons and also a veterinary anesthesiologist. He is also a fellowship lecturer of the Postgraduate College of Veterinary Surgeons, Nigeria, Ibadan Study Center. Dr. Lawa's research interest includes anesthesia, intensive care and pain management in domestic and wildlife animals. He has contributed to publications of some textbooks in his area and has published widely in referred conference proceedings and journal articles nationally and internationally. Dr. Lawal has held some administrative positions in the university, which includes level advisor, departmental examination officer, departmental postgraduate coordinator, and acting head of Department of Veterinary Surgery and Radiology. Presently, he is the clinic coordinator of University of Ilorin Veterinary Teaching Hospital from 2023 to date. Dr. Lawal is a member of some professional bodies, including Nigerian Veterinary Medical Association, Nigerian Veterinary Medical Association of Kwara State, Physiological Society of Nigeria, PSN, Society for the Study of Pain in Nigeria, SSPN, an affiliate of International Association of the Study of Pain, amongst others. Dr. Lawal is married and blessed with children. So you're welcome, sir. You have the floor now for your presentation in the next 20 minutes, sir. Thank you so much, sir.
Thank you very much. Hello, sir.
Yes, I can hear you. You can go on, sir.
Hello.
If you can hear me, sir, you can go on with your presentation.
Okay, sir.
All right.
Thank you very much. The topic I have with me is the last resort, advancing the discussion on animal euthanasia in modern veterinary practice. And an overview, I will not want to be repeating some of the things that has been described by my predecessor, how the euthanasia was originated, but it has been defined as an act or practice of inducing painless death, that is, permanent abolition of CNS function in domestic animal for reason of mercy, because you don't want the animal to feel pain. It is a permanent and emotional decision, often made in the face of incurable diseases or uncontrollable pain. There are some indications for euthanasia. It could be divided into two majorly: the justifiable reason for euthanasia and the less justifiable reason for euthanasia. For justifiable reasons, when there is a severe injury, you may need to conduct euthanasia. When there's a terminal illness that has progressed to the point where palliative treatment has little or no effect, in that wise, you will need to perform euthanasia. When there is an injury or disease that resulted in permanent loss of bodily function, you may need to perform euthanasia. Old age, when physical health affects the quality of life, you will need to perform euthanasia. When the animal is aggressive to the point of being a danger to human being or to other pets, in that wise, you will need to perform euthanasia. Or when the pet has a serious disease that will be passed to humans, that is zoonotic diseases, in that wise, you may need to perform euthanasia. But the less justifiable reason also include when a family member, for whatever reason, does develop allergy to the pet. In that wise, they may suggest euthanasia. Or probably the owner cannot cope financially. Instead of allowing the animal to be suffering, we may suggest euthanasia. At times, the owner may relocate. There was a case presented at the University of Ilorin Veterinary Teaching Hospital in 2023. The client was relocating to her home country, and the Nigerian indigenous dogs that she had could not be allowed in their home country. As a result, and they could not trust anybody for the best management of that pet. So she decided that we should euthanize the dogs. Even some of our colleagues wanted to adopt those dogs, but she refused. So then impulse buy or unwanted gift. Some people can just give you as a gift and they present a dog to you. And if you are not you are not familiar with the management of such, you may need euthanasia. Then some people are interested in keeping pets because they don't have the experience on how to go about it, and it becomes a problem. They may end up requesting for euthanasia. When there's a changes in the domestic situation, for example, a family has a dog, and then after divorce, who has the dog becomes a problem, they may end up suggesting euthanasia. Or arrival of a baby, maybe they have not had children for some time, and immediately they now have children, they now, oh, instead of keeping this pet, let's face our baby. Or there's a family bereavement, a situation where the person that is taking care of the dog dies. In that situation, they may want euthanasia. Then what are the welfare factors in recommending euthanasia? We have physical factors, we have mental factors, and we have quality of life. The physical factors include the pain. Is the animal in pain? If yes, can the pain be controlled? If the pain cannot be controlled, then you have to go for euthanasia. And maybe there's a lack of mobility. That is, the animal cannot ambulate around on its own without help. In that situation, it becomes difficult because you cannot go anywhere without the dog. Automatically, you can suggest euthanasia. Then when breathing becomes very difficult, you may suggest euthanasia. Then the mental factors include, does the animal will to live? In that wise, you see what you can do. But if the animal is not willing to live due to the conditions, then you can suggest euthanasia. Then when the animal wants to go to work or mix with people, in that wise, the animal is interested in life. When there's depression, that is over anxious or suffers from separation anxiety, in that wise, you need to suggest euthanasia. Then quality of life. When the animal does not enjoy eating and drinking any longer, the quality of life will be affected, and euthanasia will be the only option. When there's loss of control on urination and defecation, in that wise, the animal has to be euthanized. Overall, where you now realize that the number of bad days exceed the number of good days, automatically euthanasia will be alternative. What are the principles of euthanasia? One, the basic requirement is the creation of unconsciousness state before the termination of vital organ system function. Because if the animal has not lost consciousness, the animal will feel pain and agony, which we don't want in euthanasia. Pain perception requires functional cerebral cortex. Therefore, an unconscious animal does not experience any pain. Euthanasia is performed with as little stress as possible in order to reduce the emotional distress of the animal. Also, we don't want emotional distress of the observer or the people that are performing the procedure. Almost all drugs that is used for sedation and anesthesia have the capability of producing death. if given in sufficient doses. Anesthetic drugs offer the advantages of producing total unconsciousness before cardiopulmonary arrest and elimination of the brain electrical activity. Euthanasia also often requires the ability of physical restraint of the animal. In many species, capturing and immobilizing the animal for euthanasia may cause a variety of aesthetically unpleasant responses like vocalization, aggressive behavior, immobility, because the animal is afraid, is in fear, urination and defecation as a result of anxiety and fear. You can see the animal sweating, salivating. You can even see skeletal muscle tremor, spasm, and shivering because of the fear of what is going to befall the animal. In this case or condition, sedatives are administered first, especially to excitable or vicious animals before euthanasia to facilitate handling and to also reduce the animal stress. Selection of a method of euthanasia depends on some considerations. One, species of the animal you want to euthanize, size and weight of the animal you want to euthanize, type of physical restraint that is necessary for the animal, owner's preference, skill of the personnel or the risk to personnel is also part of the things to be considered. Number of animals to be euthanized is also a factor to consider. Then economical value of the procedure or technique that you want to employ is also very, very important. Then the facility that is available at the veterinary hospital or veterinary clinic where the procedure is to be taking place is also important. Criteria for evaluating acceptable methods of euthanasia are: you want to produce death in this animal without pain, that is a painless death. You want to restrain, that is the restraining capability of the method you want to use, the ability to minimize physical and psychological stress in the animal. The time required to produce loss of consciousness and death should be relatively minimal. It should not be unnecessarily prolonged. The method or technique you want to use must be reliable. That is, you are very sure that after you have used the technique or the method, the animal is going to die without any pain. Then you have to note that the technique must be safe to the personnel. Then it should be without unnecessary emotional effect, either to the animal, to the client or the observer, or even the person that is performing the technique, the procedure. Economic consideration is also very, very vital because the cost must not be too much so that the client will be able to afford it. Then, what are the methods of euthanasia? From my slide, it is categorized into three. We have unacceptable method. Unacceptable method are the method that you cannot use alone because before the animal dies, the animal may be conscious and then the pain will be elicited. So this one includes exsanguination, if you have to do it, the animal must be on the plane of general anesthesia so that it will not feel the pain before the death. Air embolism. You can introduce air into the blood vessel. This one is very, very painful. In fact, it may accompany convulsion, episiotomus, and focalization. Therefore, it should be done only in an anesthetized patient. Drowning is another method that is not acceptable alone. In fact, it is an inhumane means of euthanasia. The use of strychnine, this one too, causes violent convulsion and painful muscle contraction. So if you have to use this technique, the animal must be under general anesthesia, that is, will be totally unconscious. The next one is the use of neuromuscular blocking agents, which include magnesium sulfate, potassium chloride, and clariform agents. This one could be used only if the animal is under general anesthesia, that is, when the animal is unconscious. Because if you use it alone, the drug will cause cardiorespiratory arrest before unconsciousness, and the pain will be too much for the animal. So it should not be used alone, except the animal is under general anesthesia. Chloroform is also one of the unacceptable methods because it is a known hepatotoxin and it's a suspected carcinogenic, especially to humans. Therefore, chloroform should not be used as a means of euthanasia. Cyanide, this one too poses danger to the personnel. Therefore, it should not be used. Then stunning. Stunning will only render the animal unconscious, but it will not cause death. Therefore, it is not a method of euthanasia. There are other methods that is conditionally acceptable. This one, they are conditionally acceptable because they could be used when you don't have other alternative. That is the use of carbon monoxide. You know, the carbon monoxide will combine with hemoglobin, thereby preventing its combination with oxygen. It will cause fetal hypoxemia. Then the species, as I said earlier, that we could now use carbon monoxide for include most species, including those cat, rodents, and birds, reptiles, and zoo animals. However, it is acceptable only when equipment is properly designed and operated. Of course, it cannot be recommended when there are other safer or faster methods that are available. The next one is the use of nitrogen. The mode of action of nitrogen is also similar to that of carbon monoxide a bit, thereby reducing the partial pressure of oxygen available to blood, and it causes hypoxemia. It is useful in some species, especially the cats, small dogs, rodents, rabbits, and birds. Other small species of zoo animals will also benefit from the use of nitrogen. Although it is not acceptable in most animals that is less than 4 months of age. And of course, it cannot be recommended when you have a better or less stressful method to produce euthanasia. The next one is decapitation or cervical dislocation. This one, the mode of action is by direct depression of brain and hypoxia due to disruption of vital centers. The species that you can use this technique for include poultry, birds, laboratory rodent and rabbits, fish, amphibians, and reptiles. In most cases, this technique is used in research setting only when scientific justified and approved by the International Animal Care and Use Committee of that institution. Of course, it cannot be recommended when you have a better method that is safer and is more reliable in the animal. Gunshot or captive bolt is another technique. Mode of action is also for direct contusion of brain tissue, physical damage to the brain, and then hypoxia due to disruption of the vital center. The species that can use this technique for include ruminants, horses, pigs, dogs, rabbits, zoo animal, reptiles, and other wildlife. But this technique required special skill. Then there must be adequate restraint and then proper placement of the captive boat you want to use. It requires the skill and appropriate firearm that you will need to achieve your desire. Of course, it cannot be used routinely in animal control situation. These are conditionally acceptable methods. However, the following are the acceptable methods, which includes the use of injectable anesthetic agents, especially the barbiturates, thiopental, pentobarbital, and so on. The dosage that you are going to use will be very high and to be above the normal clinical doses that you use for euthanasia. Like pentobarbital, 6% is used for anesthesia, but there's another one, 20%. In fact, the brand name is called Utatal. Utatal to show that it has to do with euthanasia. There's another brand that is 39.6%. That one too is used for euthanasia. The mode of action of this agent is direct depression of the CNS, that is the cerebral cortex and the subcortical structure, and finally, the depression of the vital center, that is cardiopulmonary systems, renal system, and everything will be depressed, and all the centers will shut down. Direct depression of heart muscle, hypoxia, that is due to the depression of the vital center, all these will now lead to the death of the animal. However, because of the severe depression of the central nervous system, the animal will be totally unconscious and no pain will be felt by this animal. So what are the species that you can use this technique for? You can use it for all animals, including dogs and cats, even horses, and other small mammals who benefit from the use of barbiturate. Then, apart from the barbiturate is not the only injectable anesthetic agent that you can use. All other injectable anesthetics could also be used, including alpha-salone, ketamine, hydrochloride, and other available injectable agents. But they must be given at a very high dosage that is beyond the anesthetic dose, so that the depression will be so much that it will go beyond anesthesia to delirium and then the death of the animal. Inhalant anesthetic agent will also be useful in this wise. And then also, what they use for is that they are highly effective, and then the acceptable intravenous and intraperitoneal administration route will be used in small animals. So the mode of action of inhalant anesthetic agents is just like that of injectable anesthetic agents. There will be direct depression of the CNS, and then there will be hypoxia due to the depression of the vital centers. All the species will also benefit from this technique. However, although it is highly effective, provided that you subject the animal to sufficient dose of the agent that you administer, it is acceptable, but the cost of administration may limit the use of inhalant agents. Carbon dioxide is also a gas that could also be used, and is part of the acceptable method of inducing euthanasia. It's also causing direct depression of the CNS. There's depression of the heart muscle and hypoxia resulting from the depression of the vital centers. The species that is suitable for this technique include small laboratory animals, birds, cats, small dogs, zoo animals. It is effective, but it requires a prolonged period of time, which you may not really need, especially in immature animal and in neonate animal. Rabbits, cats, and pigs appear to be more distressed by this technique. Therefore, it's better you go back to injectable anesthetic method of inducing euthanasia. So how do you now conduct euthanasia? Where do you do or perform euthanasia? Euthanasia can take place at the client's home or a veterinary facility. At veterinary facility, you give appointment to your client at a time that you know the clinic or the hospital will be most quiet, because the procedure that you want to carry out does not allow for any disruption or unnecessary noises around. What are the procedures for euthanasia? Client wishes should be respected as to whether to stay with their pet during euthanasia or to leave the room when you want to perform euthanasia. 2, exactly what to be expected should be explained to the owner who wishes to stay with the pet, because we want to be sure that it will be able to withstand the presence and then the experience that the animal is going to pass through. The owner should be encouraged to cradle the pet's head and to stroke and talk to the patient throughout the procedure if you'll be able to stay with the animal. A nervous pet should be restrained with a muzzle and may be necessary be sedated, especially when you observe that the patient is stressed. The veterinary surgeon and the nurses that are going to perform the procedure should remain calm, and then they will be speaking softly and kindly to the pet, and they should be addressing the pet by his name. In potentially difficult cases, the animal with low blood pressure should be euthanized by other technique apart from intravenous injection of the euthanasia solution. When the animal is pronounced dead, at least all the vitals will have gone. There will be pupillary dilation, and then you will see that the rigor mortis after some time will start setting in. The anal sphincter reflex will have disappeared. You can even experience urination and defecation. All this will tell you, apart from the pulse that will have gone, the heartbeat will have stopped. Then the animal is now pronounced dead. Once the animal is dead, you have to remove all these restraining devices and the catheter that is used in administering the agent. You have to put a clean absorbent pad beneath the animal and a blanket over the body. And you have to leave the head exposed. You have to dispose any syringes, needles, and bottles as soon as possible. Owner may be allowed to spend some time either alone with the pet, or if they want the veterinary staffs to be with them, they will be together. Owner who has not been present, especially when the euthanasia was to take place, should be allowed, and other family members too that are interested in seeing the carcass should be allowed to witness it, so that they will be sure that truly the animal has been euthanized and the animal is dead. The charges for the service should be deferred in most cases, although in Nigeria, if you know the client is a stranger, or you know that the client is difficult, it's not always compliance in paying bills, you can still get your bill immediately. But if not, you could be deferred until a more suitable time, and then you talk to the client, and then you encourage the client. Some clients used to break down when euthanasia has been carried out. In fact, some of them may be reacting to the extent that they will be regretting the action initially, but over time, they will get over it. In fact, some clients may be may be advised to visit a bereaved counselor so that they will advise them on how to manage and cope with what they have just experienced. Here are a few things, further readings. I want to thank the Farm Alert and the Dean of University of Ilorin Faculty of Veterinary Medicine, Professor Mrs. Aziz, for giving us this opportunity. I want to thank my audience for their listening. Thank you very much.
Wow. Thank you so much, sir, for this presentation. Really an eye-opener, and it exposed us to quite a number of areas that we should take note of. Thank you so much, sir. Yeah, so the room is open now for questions, for comments. If you are not at a place where you could unmute, you can just send in your questions or your comments via the chat box. But then if you are in a place where you can speak freely, you can just use the raise hand icon, and then we'll let you speak. Can we hear me?
Yes, we can.
Okay, so if you have a question, just use the raise hand feature and ask your question. But then, before we get somebody to ask a question, I would just want to ask, so cases where either of the hub experts could answer this question, but then cases where, as a vet, as a clinician, it's obvious that this animal, looking at the conditions we've gotten from both presentations, it's obvious that this animal, this pet can no longer continue. The only option is euthanasia. But then the client is still insistent that this my pet can still live. But then you've seen all the signs, and like you said in your presentation just now, you said when the bad days are more than the good days, it should be tilting towards euthanasia. So in these cases where the clients, the pet owners are refusing to see the reality, what can we do as a clinician, even in spite of counseling and then making them understand the situation?
In that regards, it is difficult. You cannot just go ahead with euthanasia because you need the consent of the client before you can go for euthanasia. But you have to continue to educate the client, and you make sure the client visits the pet regularly so that you will now see the deteriorating condition of the pet despite the intensive care unit the patient is placed. So after some time, he will realize that there's nothing else he could do than to allow euthanasia, because he will realize that the animal is suffering, and then the animal will be in pain, because there was a condition. There was a patient that was presented at our veterinary facility sometimes. It's a tumor case, and this tumor has metastasized into the lungs, and we informed the client. The client said, hey, you can see the animal is still okay, he's still fine, although he's having some challenges. So after we explained all those things, he still refused that we should not euthanize. But I now told him that he will be coming every day. We admitted the animal, and then he was coming every day. So by the time he did that for 5 days, he was now seeing that the situation was deteriorating and the animal was feeling bad. In fact, after some time, he was even weeping. I said, oh, please, I think you need to do this thing, please, please. It was even the one that was not begging. I said, no, let us see if the animal could still live. So at that point, I now know that, yes, there are still reasons why we should euthanize. You just have to let him still reason why you should euthanize. Not that we just force it on him that we must euthanize, or else he may not be happy with it. So I think that's the ways you can use to encourage him when it becomes necessary for euthanasia.
Okay, okay. Thank you so much, sir. Do we have any other person with any question? If you have any question regarding the presentation, or you have any comments you would want to make, just use the raise hand feature and then we give you access to speak. Okay, do we have anybody, any question? You know, sometimes our lecturers in school always say that when there are no questions, therefore means that we fully understood the lecture. Okay, all right. I was going to ask Prof, but it seems he's no longer on the call. Okay, so there's a question here. Can you hear me, sir? So there's a question that says, what is the residual dose implications on euthanasia in food animals? Sir, did you hear the question?
Yes, sir.
Okay.
Residual, once you euthanize an animal, whether food animal or not, that animal is no more fit for human consumption. So once you euthanize, especially you use anesthetic agent, once you use chemical, any anesthetic agent, that animal is not fit for human consumption. In fact, it is suggested that such animals should be buried, because if not, if you put it where the animal, dog or other animals that is roaming about who pick such carcass, definitely it will have effect on them, depending on the dose that is on that the animal takes. If you take a large dose, the dog too may die. So it's better you bury such animal or you dispose properly so that no other animal can get in touch with it. And if it is food animal, for you to have euthanized with any agent, it is advisable that is not fit for human consumption any longer. Thank you.
Okay. Thank you so much, sir, for that answer. And we really want to thank everybody. I want to believe that nobody has any other question. But for me, this has been an eye-opener, because for most part of our training, you just want to do your best as clinicians to make sure that the animal survives regardless of what's passing through, and that is why we looked at the topic and we termed it the last resort. Euthanasia should be the last thing you should think of, but then we should also try our best for the animal to survive. But then in cases where there is nothing to do, then we now resort to euthanasia. Thank you so much, sir, for your time. So we'll quickly take the post quiz. We'll quickly take the post quiz, and then we conclude. All right, so the post quiz is on. So if you are here, you can just quickly answer. There are 5 questions. These are some of the things that were mentioned during the course of the lecture earlier today. We just have the next 5 minutes to answer these questions. As we answer these questions, you should just to give us an overview, euthanasia as the last resort when it comes to veterinary practice. We have looked at some agents that are necessary when it comes to establishing the euthanasia process. And we've also looked at some of the unacceptable methods, the acceptable methods. We've also looked at the drug interactions with euthanasia agents, and also the ones that are available. And if there is something that I have come to note today, is that when we use euthanasia agents, especially barbiturates, for food animals in a certain dose, those animals shouldn't be consumed. Those food animals shouldn't be consumed because of overdose or residual effects. So these are really, really wonderful information for us. Yeah, so we have 3 more minutes to answer the post quiz. 3 more minutes, 3 more minutes. If there is a phrase that has stuck with me during the course of this presentation is, if there's a phrase that has stuck with me during the course of this presentation, is before you look at euthanasia as an option, make sure that the good days are less than the bad days. So if a pet is having more of bad days when it comes to responding to treatment than the good days, then euthanasia should be an option in that regard. We have 2 more minutes to respond to the post quiz before we conclude our meeting for today. Yeah, I can see that a whole lot of us are answering the questions. Just a few of us here have not responded yet. We still have less than 2 minutes to respond. 5 questions in total. Just about 50% have responded to the post quiz. We have 1 more minute. If you are yet to respond, quickly go through the post quiz and respond. Okay, 30 more seconds. 30 more seconds. Euthanasia as the last resort in veterinary practice. Okay, thank you so much for participating in the quiz, in the post quiz. Right, thank you so much for participating in the post quiz, and we hope that you had a wonderful session from both presentations that we had earlier today. But just a quick one before we conclude for today. This Tecla session is now a private continuing education provider to the Veterinary Council of Nigeria. We give out certificates. Although the training is free, this lecture is free, but we give out certificates for a total of 3,750 naira. And these points are needed for you for your renewing of your license for the upcoming year. So these are the steps towards making the payment. You make your payment into Farm Alert Echo. Those are the account details provided for you down there. And then, or you can send a message to that phone number there for verification and your certificate. You can take a screenshot if you're using your laptop or your phone, any device, so that you can refer back to it later. And we would also love to get your suggestions, your recommendations on what topics you want us to address moving forward. We still have a long year ahead of us. What topic recommendation would you like us to address in the next session? So before we conclude now, we'll just give our hub experts 30 seconds each. What would be your take home for us regarding the topic? 30 seconds each. Dr. Lawal, can you speak?
Hello, sir.
Yeah, yes, sir, yes, sir. Just 30 seconds. Your final words regarding the topic.
I just want to summarize what I've said earlier, although you have assisted me, that once you know that the good days of the animal is less than the birth days, it is better you euthanize the animal. And then once the animal is euthanized, kindly dispose properly. So thank you very much.
All right, thank you so much, sir. Prof, if you can hear me, can you just give us a take home? What would be your final words for us during the course of this presentation? I think we've lost Prof here. But nonetheless, thank you so much, everyone. So what you can see now is make sure you if you want certificates, you can quickly make the payment and then reach out to that contact on via WhatsApp or via a phone call to verify. And we have seen some of the topic suggestions that some of us have dropped so far. We will take note of that and we'll do something about it. So follow us on our social media platforms, on YouTube, Farmalert, on LinkedIn, on Facebook, on Instagram. You can also visit our website as well. Just search whatever platform you go to on Google, just search Farmalert and you would see something about us. Do well to just follow us so that you can get updates whenever there are any. Thank you so much, everyone, for coming. We really, really appreciate, and we hope to host you again sometime next month. Thank you.
Thank you very much. Zoom,